recorded, just so you know. And so anybody that was not able to make it live will get a recording. In my view, it is always better to, there we go, to be here live, because I think you get so much more out of it. But not everybody I know can make Monday nights. So just be aware that, that we are being recorded. So if you have to pop out or something like that, you won't miss anything. And so I'm really excited to be here, and hopefully you can see my video, and you can also see Mark Lawrence at the same time. And then I'm going to go back to a PowerPoint shortly, but I want to welcome everybody here to our first Monday night webinar of 2021. How are we all feeling about that, I wonder? And we have a pretty exciting Monday night lineup and happening this month that I hope you've had a chance to see. And I'm really excited to start off the series with the class on breathwork, because I feel like it kind of sets you up for all the other classes. And so if you can't see the video, I don't know about iPhones. If somebody has any suggestions for Sue on how to see a video on an iPhone, if you could put it in the chat. You got it. Okay, good. So we're just kind of getting back, or maybe just getting used to Zoom again. And before we, okay, Gail can't see, hey, Mark. 4 different views. You can go up to from my computer is the top right-hand corner. You can see little icons. And there you can choose like a presenter view or a gallery view or just one person view. So if you can't see Mark right now, you might see him when he starts to talk, because with the speaker view, it's always the person that's speaking. So I'm going to hand it over to you right now, and they can test that out, and you can start us off with this new year from the clinic.
Hello, I hope everybody can hear me. I just want to...
Oh, a little bit louder, I think.
Can you hear me now?
I can, yeah, hopefully, yeah.
Right, yeah, just to welcome everybody on behalf of the Bill Nelems Pain and Research Center to our first class for 2021. Yeah, and this is a really important one on breathwork. I think that the breathwork allows patients to take some degree of control over their chronic pain, and it's one of the sort of foundational steps in quieting down that overactive nervous system. And it's something that's cheap, easier to do. It gives the patient themselves control over that, which is really, really important. And I hope that everybody learns a lot of useful information and some useful tips from Madeline tonight. As I say, I think in terms of sort of starting at foundation level, it's one of the most important things that you can possibly learn in terms of chronic pain control. Lots of research around breathwork to validate its usefulness as well. Great. So yeah, again, on behalf of the Bill Nelems Pain and Research Center, welcome to everybody. Hope you have a good evening.
All right, thanks so much.
Sure.
Okay. All right, so we'll say goodbye to Dr. Lawrence, and I'm going to share my screen. And we can get started, actually, yeah. So I hope, actually I'll just stop for a second and chat. So tonight's setup, we're going to go for about an hour. And as I said, it's breath work for pain relief. Now, some of you have probably taken the Empowered Relief class, and so you have some idea about the value and the effectiveness of changing your breathing patterns to help with the pain response. So I'm curious if there are many people here who have not taken the empowered relief yet, just so I know. And if you have or haven't, you can put that in the chat if you like, and then I kind of know where we're starting from. I have taught this class in a number of different ways, a number of different times, and every class is a little bit different, and it also depends on what the needs of this group are and what you. Okay, so we've got some yeses, and we've got some first timers here. Okay, so some experience, but yeah, but not everybody. Okay, that's totally great. No problem. No problem at all. So I just kind of know where you're at. And if you're wondering about what empowered relief is, it's a 2-session class that the pain clinic offers that I would really highly recommend. And it went out in the new schedule. And after you do the empowered relief, then you have access to the 8-week classes that the clinic offers. So that's the class that I was talking about. So yes, this class, as I said, it's always a little bit different, but the basic skills remain the same. So I should introduce myself. I'm Madeline Eames, and I work at the pain clinic right now doing mostly online classes. My background is as a therapist, as a trauma therapist. And then I got into more working with chronic pain because that seemed to come up in so many of my clients. And the reason I then kind of evolved into really taking breathing and breath work seriously, and this was, oh gosh, 10 or 15 years ago, it was almost by accident. I saw that when people came in, they were usually either very pressured because they were stressed and in pain and they weren't really breathing, or almost gasping sometimes, or breath holding. And when we were able to regulate and deepen the breath, that things then started to change more quickly, and they started to heal and be able to think more clearly, and so on. So I started teaching breathing probably, oh, I want to say 5 or 6 years ago. And I'm still as passionate and as enthusiastic about breathing as I was in the very beginning. And I'll just share a very short story before we dive right in. Just this weekend, this probably happens to me on a weekly basis. This weekend, I was out with a friend who just had a knee replacement, and she's also a physician herself. And she said to me, Madeline, I just discovered that she was having a lot of pain throughout the night. And she started to, because of her surgery, she was waking up with pain, and she was anticipating the pain increasing and getting to intolerable levels. And this was keeping her up or waking her up through the night, as I'm sure a lot of people here have also experienced. We do have a webinar on sleep coming up, just a heads up. And she knows what I do. Yet until you've been in that experience where you really are looking for some relief, like you really need something, and perhaps the medication's not working or you don't want to take anymore, she said, you know what I discovered? Breathing. And she started putting on, as soon as she woke up and she could feel the pain starting to increase, she would put on a meditation breathing app on her phone. And she said, now I know why you are teaching this, because it's sometimes the only thing that we have. And it brought it right home for me again, that this is why I teach this, because sometimes it's the only thing we have. And that is whether you are struggling with chronic pain, with high anxiety, with panic attacks, with just stress, with driving, or parenting, sometimes it's the only go-to that we have in that moment. And it works. It works. So, and just another validation for why these classes are so important. So I'm glad that you're all here. Yeah, I know. I hear you about the evening classes. Empowered Relief is going to be mornings this month, and then we're going to do evenings next month. So just so you know, we're going to alternate that because some people just can't make it during the day. All right. So breathing, breath work for pain relief. So we have we'll do a little bit of practice. Well, hopefully we'll have time for quite a bit of practice at the end. My background also comes from yoga and mindfulness. So I've kind of had a chance to explore many, many different types of breathing. And it seems like every time I go to teach a class, there are new techniques coming out, which is kind of a strange thing. You know, when you think about it, there's this breathing that we've been doing ever since we entered this world, and we will 24/7 until we leave this world. And now there are so many classes teaching us how to do this. But there's a reason for that. So Dr. Andrew Weil, who I really, really respect, you know, I always like this quote. It says that improper breathing is a common cause of ill health. If I had to limit my advice on healthier living to just one tip, it would be simply to learn how to breathe correctly. So there's no single more powerful or more simple daily practice to further your health and well-being than breath work. That being said, I agree with Dr. Weil, but you may have other things, of course, that are in your toolbox that are also powerful for pain relief. And that, of course, includes all the tools in the toolbox, including medications and interventions. But there's a reason why this is so powerful, and we're going to get into that tonight. So, as I said, you know, this seemingly very simple thing, breathing, there's new paths all the time, there's new techniques all the time. And that really depends on the destination that you want to get to. So, there are really what I see as two distinct areas of breathing. And one is the more calming, relaxing, restorative, nervous system regulating breath. And the other is the more transformational, more treatment. You may have heard of integrative breath work, or if anybody's tried holotropic breath work. There's a whole bunch of those more powerful breathing techniques that you know, are said to heal trauma and all kinds of things. But what we're going to do tonight are really the patterns or the tools that are geared towards relief of pain, chronic pain, since that's what we're talking about. But you know, obviously, it's also taught for women in childbirth. It's taught to Navy SEALs who are under high stress. Um, it's taught in all different contexts. And the idea being that this camp, the more relaxing, restorative, that shifts our nervous system out of the stress response. So the stress response that we will talk about briefly tonight is the same mechanisms as the pain response. So that's why this is your own, really your own natural medicine as the antidote for the pain response. The transformational, I'm curious if anybody has done any of those transformational breath workshops. I've been to quite a few because I was curious. And all I can say is some of them are very powerful, which speaks to the power of the breath. but and they can also be quite activating, quite agitating. So if you do see breath work workshops, just just pay attention that not all breathing is the same. And again, it depends on the destination that you want to get to. And I think here tonight, we probably all want to get to the same destination. I'm guessing you could, you feel free to put in the chat what you really, really want to get out of tonight. But my guess is that we are looking for a way to be able to self manage our pain in the short term and also be able to heal over the long term. Anyway, that was my idea of what I was going to teach tonight. So I hope that's online with all you guys. All right. So we're going to start with some breath awareness. The breath is a barometer to our internal state of being. So we can't really see everything that's going on. Well, we can't see everything that's going on inside our body, but our breath is something that we have access to. And it's the I think it's the only part of the what we would call the autonomic nervous system. In other words, our nervous system that's keeping us alive. It's the only aspect of that that we can actually have some control over ourselves. The other parts of the autonomic nervous system would be things like heartbeat, gastrointestinal, endocrine, all kinds of other systems, but the respiratory system is the one that we have access to. So let's just start by checking out for yourself right now what your barometer is saying. So, what is your weather pattern today? And how we can do that is just by noticing right now. You might want to just just notice how you're sitting. See if you can, for the next hour, sit um, as comfortably alert as possible. And if you're sitting, you might have your feet on the floor. If you're lying down, you could uncross your arms and legs if you want to. Sometimes that helps to be a little bit more relaxed. And start by just bringing your attention in towards your breath. So just notice your breath right now and just let it be natural. And just see where in your body you feel your breath the most. So you might notice as you become aware of your breath, it might start to naturally slow down on its own. Or you might notice that it feels very short and shallow. It could feel tired. It could feel rapid and stressed. It could feel racing. Or it could feel deep and relaxed. So just notice, and we're going to move right into a little grounding exercise. So just notice that first. And then everybody just take a nice long exhale out when you're ready. Exhale out. And then a deeper breath in. So inhale. And then exhale out of your mouth. And as you do that, let your shoulders and your jaw relax down. And then inhale deeply, perhaps a little bit deeper. Exhale out of your mouth with a sigh. Let all your shoulders, if you can, and your jaw, your forehead, and inhale. And when you're ready, exhale and just let gravity allow you to ground down, right down into your feet or into your chair, into your bed. See if you can notice that difference One last one. Deep breath in. If you can, no pressure here. And then one more. Let go of your day. Let go of your day. Come right into where you're sitting. Perhaps feel your feet. Feel maybe your lower back or whatever makes sense for whatever is supporting you to sit or lie down. Okay. And then just return to your natural breath. So I'm curious with that, just looking inside for a moment. And some of you may have had difficult days. You might have had busy days. You may have had high pain day today. Um, to just, of course, be aware of that. Was there a word that you could describe your initial breathing pattern with? And if you could, put it in the chat box. So, what did you notice about your breath? And did it tell you anything about yourself? Okay, so I'm seeing closed. Closed is quite a good word to describe. And I'm imagining tight, short. I'm imagining that means like shallow. Yeah, shallow, fear. Okay. Erratic, relaxed but shallow, short, calm and slow. Okay, short and shallow, unaware. Okay, relaxed. Adjusted your body position. Okay, awesome. Anxious and short. Okay, quick. Relaxed and shallow. That's interesting. Okay. Yeah. Slow but shallow. Rapid short breaths due to stress. Okay, awesome work, you guys. Wow. Okay, difficult to change that. No worries. Okay, right now there's no well, there never is, but no pressure to change that at all. Okay. Now you have a sense. I'm seeing a lot of kind of rapid short breaths, some stress, fear, which really goes part and parcel. It may go part and parcel with other things in your life, but absolutely goes part and parcel with living with persistent pain. Okay. Um, Always breathing through nose. Okay, so we can get into nose and mouth a little bit later. Right now, what I'm going to say is that whatever you can do is what you must do right now. And there are different breathing techniques that use nose and mouth. The nose, it warms and purifies the air as it goes in, but sometimes it's easier to breathe through your mouth, or at least breathe out through your mouth. All right. So, as John Kabat-Zinn says, as long as you're breathing, remember that there's still more right with you than wrong with you. So, never feel like you are doing any of this wrong. If you are doing it, that's the main thing. There's no wrong or right here. Thank you for adding that, for popping that in the chat. So, some common breathing reactions to pain is the most common one I see is actually breath holding. So yeah, we usually hold our breath when the pain gets worse. And there's a reason for that. A few of you have done this with me before. Take your fist in front of you right now. If this feels okay for your hand, follow yourself first before you listen to me. And as you make a fist and just squeeze your fist, you don't have to do it too drastically, but just squeeze your fist. And notice when you squeezed your fist, what happened to your breath? Now relax. Okay. So what did you notice when you're tight or when you are bracing? Like this actually looks like I'm ready to fight. Tight muscle tension. I'm curious what you noticed about your breath. Probably guess, but when you squeezed your fist. Tightening breath, stop, shorten, shallow, tight breathing. Absolutely. Okay. Holding, shorten. So all those things that we just talked about, this is a really common reaction when we have pain in our body, we hold our breath or have short, shallow breathing. Or the third one is, if you notice this, I always have to mention this so you know there's nothing wrong with you. This is a pattern, is actually reverse breathing. So I've met a couple of people who when they breathe in, their abdomen or their belly, that we'll get into later, actually goes in, and when they breathe out, it goes out, which is actually the opposite of what should be happening. So, but the most common, as we just found out, is breath holding and short, shallow breathing. Now, when we're able to relax our muscle tension, it works hand in hand with our breath, and that affects pain. So you might look at those and go, well, what does that have to do with pain? When we can change our reaction to our pain changes. Okay. So just in daily life nowadays, and I know that over the last year, it's been a particularly tough time for a lot of people, perhaps being isolated, and literally, a lot of people in the world under lockdown, worry, and so just in daily life, pain, stress, thoughts, and fear cause us to lose touch with our innate ability to return to our natural, full, and easy breath, okay? And deep breath that we knew how to do when we were born. We have this ability, and I am just here to remind you of what your body already knows, but has to be retrained, because by the time you're probably all adults, I'm guessing, but even if you're not, in this world, we naturally start to shorten our breath because we have so much coming in at us and in us. So it leaves us in this state of perpetual tension and bracing, as in, the fist, bracing in our body, and also bracing in our mind. And what I mean by bracing in our mind is that part of our natural response to any threat, which it could be stress, could be pain, fear, is that our thoughts start to race, and they become negative racing thoughts. And that is our mind bracing, trying to protect us. So all of these things are working together. So has anybody ever tried to stop their racing thoughts? Have you ever tried to intervene that way? I'd be curious to know how that went. Have you ever tried to stop your mind, or actually like clear your mind or clear your thoughts? Yes. And I would be curious to know, I'm seeing a few yeses. No, yes was really hard. Just so you guys know, it's okay to just send it to me, a panelist, if you want to send it to everybody, panelists and attendees. Yes. Okay, I'm seeing lots of yeses. It was meditation, but it's hard. Makes the thoughts increase. Didn't work. Okay, yeah. Sometimes with meditation over time we can do that, but in the short term, it's really difficult to stop a racing mind that's trying to protect you. So we're going to try a different way. And there's two other ways that I'm going to give you a really simple formula at the end. And if we could just clear thoughts and just be mindful of the moment, which really is the goal of mindfulness. And it's something we can also get to through breathing. So if you find yourself always feeling like you're in a traffic jam, you're not alone. You're not alone. And we want to undo some of those habitual patterns in the body and the breath. So deeper, fuller, and easier breathing is really a key part of healing emotionally and physically. And I wouldn't have said this. If you had told me this 20 years ago, I would have said, well, everybody's breathing. But I didn't realize what an integral part it is really of being able to start the healing process, to put your body in a place of in a healing spot so that it can actually restore and do the healing work that it's meant to do. Our bodies already know how to do the healing if they're given a chance. If you cut your hand instantly before you even see it, your body is already getting to work in the healing department. And breathing can be a really key part of that. So, how we breathe can influence and affect our thoughts and our feelings. And how we breathe can directly affect our pain response. And when I say pain response, I'll just quickly talk about primary and secondary pain. If anybody has heard of that before or not heard of that, with our primary pain, it's kind of what maybe what started things to begin with. Maybe there was an injury, maybe there's a condition, maybe there was even a viral infection that started this, or some perhaps some underlying condition that you are struggling with. The secondary pain is the reaction that we have to this condition. So what it's almost like some people call it the clean pain and the dirty pain that comes on top of it. And that is the muscle tension, all the emotions that go with chronic pain, you know, the fear, the sadness, the loss, all of those things. They're painful. They're painful. Um, and the response in the breath, the body, and the mind. So that is the secondary pain response. I'll just say that much for now. And if you've taken empowered relief, you probably know you get what I'm saying a little bit deeper. And if you haven't taken it, it's really worth doing. So how we respond to our pain influences our pain. And when we are able to breathe more deeply and more fully, so this is the part that is really worth taking note of. And I always, every time I, go back and look at the research, it reminds me of all of these things, that your body naturally starts to relax and begins to release the tension. Okay, so just to be able to release some of the muscle tension that is in response, is bracing really around the pain. Oxygen increases within the body. So you're bringing in higher oxygen levels. The nervous system starts to become more regulated. And in other words, it sends a message through your spinal cord up to your brain that I am safe. Even though my body is telling me something different, i.e., I'm in pain, right now in this moment, in this very moment, in fact, I am safe. And when that message gets sent into the nervous system, the harm alarm or the protective alarm of pain can start to turn down the volume. But you can bet there is no way that the pain's going to turn down the volume if your body does not feel safe. And one of the ways that the body does not feel safe is when there's short and shallow breathing, because your body might think you're running away from a tiger or jumping out of oncoming traffic, and because it's the same response in the body. I forgot to tell you guys, as we're going through this hour tonight together, to make sure that you are keeping yourself comfortable as you're listening, if you need to move around, if you need to lie down or have a glass of water. All of these things are messages to your nervous system saying, I got your back. I'm listening to you and I'm responding to you. So that's what I'm going to be doing. And listen to your own nervous system before you listen to me, even. So our heart rate lowers. You probably noticed that, decreasing the stress or the stress response in our body. And that includes all kinds of chemical responses, muscle tension. The oxygen levels flowing to the brain increase. So if I'm breathing very short and shallow, for example, if I just stub my toe and I'm in a lot of pain, my breath I held my breath. I'm breathing short and shallow, and my muscles are tense, and I might be kind of angry that somebody left something on the floor. I'm not going to have a lot of oxygen flowing to my brain. So it's not the best time for me to have a really in-depth conversation or make decisions or do my taxes, right? When I don't have a lot of oxygen going to my brain, I can't think clearly. And if you suffer with brain fog, this is also going to be really important to make sure that your oxygen levels are flowing as much as they can, so that the mind can calm and become focused and actually make good choices. And when you're having a high pain day, you may have noticed, like, what is it like in your thinking? Is it the best time to make, good choices, or, decisions about your health or other decisions? Because often we're really trapped in that, what I call amygdala hijack. Well, I don't call it that. Somebody else did, where we get really hijacked by the fight, flight, freeze response in our brain, and it's hard to think clearly. So pent up emotion and tension can start to release. So the anger, the sadness, fear, love to know any of the other emotions that you guys are feeling. Certainly the emotions that come along with pain, that, by the way, can be equally as painful. They activate the same part of our brain. So when we're able to release the emotions associated with the pain, we can also influence our pain. So I hope that makes sense. And this is important. Stress hormones are lowered. So the cortisol, the adrenaline that might be coursing through your body when your body thinks it's in danger. Because remember that pain is a protective. It's a protective signal that there is danger. And so we want to do everything that we can to allow our body to feel safe. Yeah. So frustration. Yeah, I hear you. Well, frustration's pretty common, when we suffer with pain and we can't do the things that we used to be able to do. Or the thoughts then become like, I should be able to do this, or I should be able to do more. Those thoughts also can create, frustration in the body. So what does this have to do with pain? Everything. Has everything to do with pain. All those things that I just listed have some effect or influence on our level of perceived danger in the body equals pain. Okay. So releasing tension, that releasing tension part of it, if you remember that, we're going to do some of that shortly, increases muscle relaxation and reduces the bracing around the pain. Yeah. The mind is harnessed, so we can choose thoughts that are helpful and decrease the emotional and physical pain. So sometimes, I just need to stop and take a few deep breaths, become aware, become aware of what's happening. And so I don't make a knee jerk reaction and perhaps yell at someone. I don't know if anybody's ever done that when they're, in pain, or maybe I'm the only person here. um, but to take a few deep breaths, get in more of a relaxed state, and then be able to make a choice about what to do or what to say. Um, and the body's production and distribution of natural opiates increases. So that's pretty important, and that's why this work is so important. Yeah, so I'm lie down and queuing time, spend time with my fur critter. I love that. There's always discussion of pets in these classes, always, because they're so calming. Less patience. Yeah, absolutely. Oxygen and carbon dioxide levels are balanced. So we're reducing the acidity, which puts our body in an environment for less inflammation and infection. Okay, so it actually affects our immune system. So just like the forests are the lungs of the earth, our lungs are like the forests of the body. I don't know where I got that quote from, I'm sorry. But if you can think about that, how there's this give and take with the trees, and it's the same with us, I should go like this, and our lungs. There's a give and a take. And when this comes into balance, it sends the message up again through our spinal cord into our brain that right now, this body that's breathing is actually safe despite the pain messages that are being sent. Obviously, if I fall down or I break my leg, I'm not going to be stopping I may in the ambulance on the way to the hospital, but breathing is not the answer. Surgery is the answer. But if we're talking about persistent pain, we're talking about an ongoing signal that has perhaps lasted too long, longer than it should. So a tiny bit of nervous system stuff here, that there is two branches, the sympathetic and the parasympathetic. The one is to protect us, fight, flight, freeze. And the other one is to heal us, rest, digest, and restore. And that is the one where we have a chance to heal. So let's take a moment and just practice a very simple. Each practice we do tonight is going to build on the next one. So if there was one that you could take away tonight, let's just come into just for about 2 minutes. Just take your attention perhaps away from your screen. You might even choose to close your eyes and just hear my voice as you bring your attention right back to your breath and notice what it's doing. Where are you now? And see if you can just deepen and slow your breathing pattern. Notice any muscle tension, anything that's perhaps being triggered or came up, and take a bit of a deeper inhale, perhaps right down into the bottom of your lungs. And as you exhale, again, relaxing any body tension, your shoulders, your jaw, your forehead. And just feel that in breath and that natural exhale of this life giving oxygen. Just breathing together, if you can, sending that air right down to the bottom of your lungs, knowing that is going to all the cells of your body. Just a pause to breathe can flip the switch into your parasympathetic nervous system. Okay. I don't like to make too complicated diagrams, but I really would be remiss if I didn't mention the vagus nerve. So I will just do that here. So just so you know, there is this long yellow line called the vagus nerve that is in so much of the research right now, that we have discovered that this nerve activates that rest and digest part of the branch of the nervous system, bringing us out of the pain response. And Stephen Porges, who has written books and done so much research on this theory, on the vagus nerve, has said that changing your breathing pattern is the quickest and easiest way to activate this vagus nerve. In other words, it puts the brakes on the pain response. And the fight, flight, freeze sort of activates or puts the gas on the pain response. So if you could think about it that way, as perhaps you're having one of those days where the gas is on your pain response, that you can activate the parasympathetic to start to put the brakes on. And you can see how this is the largest cranial nerve in your body. All the things that it attaches to, all of your internal organs, your lungs, and then right up into the base of your skull. So that's a good question. What if your vagus nerve has damage? And Shirley, I've never actually had that question. And so I'm not sure, but it is so the main part of the vagus nerve that we want to know about is the part that is activated. Is it attached to the dura? Okay, I'm not sure, Karen. But when the part that we want to know is the part of the vagus nerve that's activated when we use our diaphragm below our rib cage for breathing. Okay, so when we're doing the belly breathing, so that's the part, and I never heard of that quite being damaged. It's so large that there might be damage in one area, but not in another area. And Karen, I'm not sure about the answer to your question. Yeah, I'll have to. We'll have to look into that. Okay. So it's just. Oh gosh, yeah, I'm not sure about that, Shirley. That would be a great question for at the brainstem. Okay. So pharyngeal neuralgia at the brainstem. That would be a good question to ask your doctor, your specific situation, if that does affect your breathing at all. Because you can have like vagal responses, or without having damage to the vagus nerve, but I'm not a doctor, so you might want to just check that out. Good question. So the first one that we're going to do right now is one that you probably want to bring in more quickly when you're having high anxiety or panic attacks, or you have to maybe you have a fear of elevators and you have to go in an elevator, is to breathe out as if you can breathe in as well, but breathe out as if you're breathing through a straw. So this is one where it's like a first aid almost. So come back to your relaxed and alert position. And what we're going to do right now is we're just going to take an inhale, perhaps through the nose if you can. And we're going to inhale as if we're blowing out through a straw, or blowing out candles on a birthday cake. We do this sometimes just naturally. And breathe in. And breathe out, as if you're blowing something away. exhale longer than inhale. Breathe in. Breathe out. Relax your muscles. Shoulders, jaw, forehead, arms, and legs. One last one. Breathe in. And breathe out. So that was for some kind of short-term relief. I just wanted to bring that in before we go into a longer practice here. And we'll probably go 5 or 10 minutes after 7. So belly breathing, again, if there's one thing that you could take away tonight, as many of you probably might know this already, it's really useful to have this picture of what the diaphragm actually is when people talk about diaphragmatic breathing. And so you can see that how big that muscle is and how it lines like a upside down bowl the underneath the rib cage. So I'm going to keep that up right now while we do this breathing, so you can actually imagine it happening in your body. And it's not unusual to yawn, by the way, because sometimes your body is like, oh, oxygen, give me some more. Or, oh, I'm really tired. Yeah. Yeah. The vagus nerve is very, very interesting. And anything by Stephen Porges, I recommend on the vagus nerve. So, all right. So let's just do a nice, gentle belly breathing. Come back into your perhaps relaxed, alert position, and feel free to put your hands on your lower abdomen just below your belly button, if that feels right. And I'll tell you why in a minute. And just start to breathe, take a deep inhale in. Send that breath right down, if you can imagine, into your hands, not forceful. And then exhale it out. Belly goes in towards your spine. Relax shoulders. And breathe in. And breathe out. Okay. So as you breathe in, imagine that big diaphragm pushing down to make space for oxygen and just pushing your abdomen out slightly. And then as you breathe in, exhale, it retracts. It's a big muscle. And breathe in. Lungs fill up. And breathe out. Just to give you a visual. Now, your vagus nerve, your diaphragm is also affects your spine. So we'll try a little bit of gentle movement. This can feel soothing. Use your best judgment. So as you breathe in, you might just gently open your chest and sort of extend a little bit. Extend your spine on your inhale. And as you exhale, feel free to almost bend over a little bit with your spine, a little bit. And gentle movement, breathe in. And the opposite, to breathe out. Belly button kind of goes back towards your spine. So an easy flowing movement. See what that feels like as you move your body slightly with your breath. I know some people find this very, very soothing. Others don't. But as we're breathing in and out, we don't want to actually go into like a lockdown in our rib cage, like breathing in, breathing out, but to see ourselves more as being fluid rather than being stuck. So I liken it more to being like water as opposed to rock. So gentle, we obviously do this more if, we were doing yoga or something like that, but we can do it right in our chair. So easy flowing movement. So now let's move our hands to sit up here a little bit, just to the side ribs. So this is kind of an important one. I've got my hand right here with my thumbs pointing towards each other, if this feels okay for you, on my side ribs. Okay. So as we're breathing in, this is probably even more important than the belly breathing, I think. We're going to breathe in and just see if I can move my, as we breathe in, your rib cage should widen and your fingers come apart slightly. And as you exhale, fingers come more back together. Okay. So as we inhale, think of breathing out horizontally. And then as we exhale, fingers come more together. So there's a reason for this. Just continue horizontal breathing. And if any of this causes pain or discomfort, just slow down or go a little more gently, back off a little bit. So our breathing should be more 360, front to back, side to side, rather than if somebody ever asks, if I ever ask a group to take a deep breath, what they usually do is go, and their shoulders go up towards their ears. There should be very little movement in your shoulders. And think of more side to side. Breathe in and breathe out. Okay. Now drop your hands down. And we're going to continue with horizontal breathing as if your hands were there. Let's see what that feels like. And just remember to keep it gentle and smooth. Front to back, side to side. So nice, slow, gentle breathing into your lower lungs. As best as you can. Inhale through your nose if you can. Then you can exhale through your nose if you like. So as you inhale, see if you can just extend your exhale. These are kind of the important points I want you to remember. So for now, we're going to just extend our exhale a bit, tipping the balance into the parasympathetic nervous system. So we're activating that vagus nerve. We're bringing more oxygen in. Relax your shoulders, your jaw. Feel free to close your eyes. Your next inhale, you try to sip in just a tiny bit, even more air. And on your exhale, let go of any extra bracing in your body. Deeper inhale. And on your exhale, let gravity do the work to let you just sink down right into your feet. See what that feels like. Notice if you're trying too hard. And notice if you're trying to get it perfect. Is that something that comes up in your life? Okay, notice if you're efforting too much or not enough. Okay, now everybody exhale together. Nice long exhale. We're going to move into resonant or coherent breathing, which is a count of 5 in and a count of 5 out. So this gives us an average of 5 to 6 breaths per minute, which if you can do this today, great. No worries if you can't. But that is kind of the optimal breathing rate for a regulated nervous system. Okay, and it's taught a lot because it's coherent breathing, 5 in, 5 out. Okay, so nice big exhale together again. And then we're going to inhale, 2, 3, 4, 5. Pause, exhale, 1, 2, 3, 4, 5. Inhale, 1, 2, 3, 4, 5. Exhale, 1, 2, 3, 4, 5. Inhale, 2, 4, 5. Exhale, relax your muscles, shoulders, jaw, forehead. And inhale, 2, 3, 4, 5. Just like a pendulum. Exhale, 2, 3, 4, 5. One more. Inhale, 3. Biggest one, 4, 5. Nice long exhale. Let everything go, the stress from your day, any effort, any resistance that you can, all the way down, melting right into your toes. Now just resume some nice, normal, slower breathing. Check in with your body. Just see how you're feeling. Notice what you notice. No right or wrong. I see getting more air. Can't stop yawning. Yeah. And if you feel like if there's anything coming up you need to ask a question about before we move into box breathing, please do so. One of the things that often happens in a breathing class is that we do hold a lot of emotion in our lungs. And when we start to expand, sometimes there's a lot of tears. So if that's happening for you, that's a really healthy thing. And if it is not often welcome in our society to just cry. So if you take this opportunity to express that way, that is a nice big release. So just know that. Right. Yeah. So sometimes I'm going to talk about ongoing practice in a minute, Danielle, because some people might notice a relief right away, or just a little bit of letting go or a little bit of release. Sometimes if you are not used to tuning into yourself, whether it's with anxiety, stress, or pain, sometimes as we become aware of pain or whatever's going on in our body, or discomfort, let's say, sensations in our body. And so sometimes as we become aware, we notice them more. And then they can start to decrease. So if that's happening for you, you're not alone. Lots of yawning. So let's move into box breathing. And if you're pregnant, if you have high blood pressure, if holding your breath causes some anxiety, then don't do this. Just keep on going with the longer regulated breathing. But box breathing is breathing in for 4, holding for 4, exhaling for 4, and holding for 4. And some people really like this, as gives the mind something to focus on. If I will say, if you're in a waiting room, you can follow the line of the window or any square that's a box. If your mind tends to get, stressed or worried. So we'll just do a couple of rounds of this. Start by, again, coming back to your breath if you've wandered away. And again, noticing where you feel it in your body. And exhale completely. And then we're going to inhale, 2, 3, 4, hold, 2, 3, 4, exhale, let it go, 3, 4, and hold, 2, 3, 4. Deep inhale all the way up, 3, 4. Hold along the top, 3, 4. Exhale all the way out, all more than you think you can, and hold, 2, 3, 4. Nice big inhale, 2, 3, 4. Hold, 2, 3, 4. Exhale all the way out. Let every last bit of tension that you can let go of tonight. Let go whatever is possible for you. And just bring your attention back to notice your breath in this moment. Just notice how you're feeling in your body right now. See what you need. Okay. And just let me know if there's any questions about box breathing. Okay, so to make this easy to remember, I still haven't come up with a good acronym for breath, body, mind, and I've been teaching it for many, many years, because I always come back to these 3 points of attention. To feel the breath, notice what the breath is doing, shift or change it. If probably deepen in and slow down the breath is most likely what we need to do. Remember to relax the body. And I wrote mind the thoughts. So notice if you have tension in your body, what are you telling yourself in your thoughts? Okay, so that's a whole other webinar that we should do sometime. Yeah, so as you notice your thinking, you might use a technique that counts your breath. If you're trying to get to sleep at night, there's a few really good breathing techniques. You can count backwards from 10, or count backwards from 100. So give your mind something to do. The other one that actually Dr. Andrew Weil really popularized was the 4-7-8 breathing. And that, I'll just put 4-7-8 in the chat. And that is to breathe in for 4, hold for 7, and then breathe out for 8. And that is actually used to treat insomnia. It's a longer breath hold, so it's not for everyone, but that is one that you could try. So notice if your mind needs something to do. The other thing that we don't have time to get into tonight is to combine it with, some of you already do meditation, but to combine it with a visualization of a calm, healing light, or a safe place in your imagination, or a happy memory. So giving your mind something to do at the same time. There's all kinds of things you can, imagine healing light, healing oxygen going to all parts of your body that are suffering. Okay. So when and how much? I want to say whenever you remember to absolutely do the pause and the breathe. And even if you do it for 1 minute, that is still making an impact in your nervous system. And remember that the pain response is a dysregulated nervous system. And as you start to regulate and calm it, this is really, really important for persistent pain. Absolutely 2 to 3 times a day to pause and do some breathing. You can have regular places where maybe you have stickies that you put them up and on your steering wheel, or on your fridge, but you actually follow them, and you don't put too many up, because then we tend to ignore them. I've tried that and I didn't find it very effective. Maybe you will, but have it in strategic places. Absolutely. Bookend your day, morning and night. Set yourself up already ahead of the game. So I like to actually do it before I even get out of bed in the morning. I will not get out of bed now until I've done breathing. And I put two pictures here. You can do it on a really good way to practice belly breathing is on your back. So you can put a hand on your heart and one on your abdomen and breathe in. Or another way is to actually lie on your stomach, whatever feels obviously more comfortable for your body. But on your stomach, you can also feel the oxygen, your belly rising and falling. So, morning and absolutely at night, set yourself up for a better night's sleep. But do stay consistent for the next 3 to 6 months for lasting effects. So you might feel an initial, yeah, this is really good, or, something, but the real shift in your nervous system happens over time. And any lasting change will happen over time, especially when we're talking about nervous system change, right? Which really is important for chronic pain. If you prefer guided, I've just written a couple up here that you might really like. There's many on YouTube. And one I just found was called The Mindful Movement. There's a lot of different videos on there that this couple do. They look really, I tried a couple, they look good. The other one is Calm. I really like Insight Timer. Headspace is another one. Or just continue to use the guided meditation file you get when you take the Empowered Relief course. And I hope you're having some success with that. So I'm going to stop the share here and come back into the room. And yeah, just to check and see how is everybody feeling now, and if there's any questions at all around the key points of breathing. Key points meaning breath, relax your body, notice your mind, or just stay with number one. Just stay with breath. Just stay with breath, extending your exhale out and remembering, I guess you relaxed, yawning more. There's a lot of yawning going on here, which it's a good thing we do this at night, right? Imagine we did a few minutes here tonight. I think we probably did in total, 10, what do we do? 10, maybe 15 minutes of breathing. Imagine what you could do if you did 20 minutes morning and night for your nervous system. And for those of you that haven't taken Empowered Relief or any of the other pain education classes, the nervous system is chronic pain is related to having a dysregulated or overly sensitized nervous system. So anything you can do to self-manage it will be helpful to calm and regulate it. And of course, just get a good night's sleep. So yeah, looks like people are feeling really relaxed and ready to go to sleep. Let me know if there's any questions. Belly breathing, extending the exhale, and all those benefits that you're getting with it. Muscle relaxation. What was the man's name? Oh, it was Dr. Stephen Porges. I will just write it in here. I will warn you that when you start reading about the vagus nerve, It is very complicated, and there was a few years there where I thought I'm never going to be able to understand this nerve, and I realized I didn't really need to understand it. I just needed to know how to trigger it. So I'll just let you know that it's really interesting research, and it really is a key to health and healing. And I'm so grateful that that we've discovered this. But the breath, the diaphragm is using that big bowl underneath your rib cage. Um, yeah, that is will trigger the vagus nerve. Yes, we do need to know how to look after it, care for it, and keep it healthy. Absolutely. And I will also say that breathing is not the only way to engage the vagus nerve. In fact, right now, as you are looking at me and we are socially engaged, you are activating your vagus nerve. So this is if I think this has been one of the difficult things about COVID and not having that face-to-face social engagement is that we tend to get stressed and move just into a fight or flight, just biologically. And when we are engaged with eyes, voice, ears with another person, it also triggers our vagus nerve, which helps. We're social beings, which helps to calm our nervous system. Yeah, so there's actually a lot of cool ways to trigger your vagus nerve. And if you can get, a simple kind of printout of different ways, I would absolutely start. That sounds like another webinar to me. That sounds like a good one we could do. I like this. When my pain takes off, I welcome my old friend. Always ask it to breathe with me and use its energy to help me. I love that. I love that. Yeah. Yeah, we got to make friends, it's not an easy thing to do. We can uh it's it's a very disconcerting feeling to feel like you're fighting in your body, like you're at war in your body. So let the breath calm you, let it nourish you, let it nurture you into a place of great self-care for yourself. I want to leave. I'm Since I'm talking about this, I want to leave you with one last thing before we say goodbye. Oh, Julie, I just put it in the chat up there. Porges with a P, Stephen Porges, and I want to leave you with this one um, pose or position that I've been teaching to a lot of people who have been having a bit of a hard time. And it's also had some research to calm the nervous system. So it's called the self-care pose. And if you want to do it along with me, just give it a try. So you put one hand on, or right hand up on our left shoulder if you can. If you can't reach it, the arm or the upper arm. And the other one just below, across your heart and below on your other side. So almost like you're giving yourself a hug. And then bow your head very slightly forward and towards your hands. See what that feels like on your shoulders. It can be very subtle. So self-care pose, if you want, you can close your eyes and just see what this feels like as you breathe into your arms, as you breathe into your heart, and you just hold yourself. So see what it feels like. And you can see how you can tell a lot about yourself. Does this feel familiar to you? Does it feel nourishing? Does it feel uncomfortable? And what would you say to yourself if If you needed to send yourself some self-care, what would you say to yourself? So you don't have to write it, you can just think it now. And just hold yourself as if you were your pet, as if you were a best friend, or as if you were a young child. What does it feel like to just really look after yourself? And when we hold ourselves like this in self-care pose and breathe, we increase the oxytocin, the feel-good chemical going into our brain, and just bring ourselves a sense of comfort in perhaps our suffering or our fatigue or all the ways that we try. Relax your shoulders and just breathe. And knowing right now that you are safe, that you're safe. And you can even, another thing that also, again, since we're talking about vagus nerve, is is to just bring your hands and just gently stroke downwards, not up, but down. Down regulates our nervous system. So there's a reason why we say calm down. Although when somebody else tells us to, that's a different story. But you can just gently, if you ever need to down regulate yourself, just gently stroke your skin, self care pose, breathe deeply, look after yourself, and use those breathing techniques tonight as perhaps you're going off to sleep tonight. And if you wake up during the night, make breath your ally, your best friend, and your medicine. Thank you, everyone, for coming. Just make sure we don't have any questions. Thanks, everyone, for coming tonight. Oh, yes, you're very, very welcome. Next week, we have nutrition. I can't wait. 6 o'clock, same time. And we have a dietitian coming to talk to us about nutrition for chronic pain. Oh, you're welcome, Chris, Karen, Mandeep. And we also have after that, we have sleep on a Monday night at 6, and then we have physical activity with Norm from the clinic. If you're interested in the mind body skills class, that's starting up in not next week, but the week after. You're welcome. And then empowered relief at the end of the month. Email me if you have any questions, and have a good night's sleep and a relaxed rest. And we will see you next time, hopefully next week. All right, you're very welcome. We will be offering the nutrition one again. I think that was Danielle. And I think we're going to start doing it kind of on a regular basis. So to cycle through sleep, nutrition, activity, breathing, mindfulness is coming up. And we'll just keep on. Hopefully we'll try to stick to the Monday nights at 6. Yeah, you're welcome. They are recorded. Yes, they are recorded. So you will get a recording. And if you register, you will. And I always encourage people, if they can, to show up live, but obviously that's not always possible. Yeah, absolutely. Thanks for asking, Carrie. Yeah, they are recorded. If you have questions for the nutritionist, please send them to me ahead of time. Or you can ask that night. Have other Monday night. Yeah. So register. Yeah, register, and then you'll get the recording. The recording will be sent out to anyone that was on the registration list. Mm-hmm. Mm-hmm. You're welcome, Carrie. Yeah, you have a great week too. And see you next week. All right, no further questions? Good. Awesome. What a great group. What a great group. All right. See you next Monday night. We'll talk about nutrition. Bye for now. Have a good night.